Welcome back, everyone, to Better Arizona. I'm Sarah Karlstrom. How many of you out there suffer from headaches or even worse, migraines, and think there is nothing that can be done about them? Well, we've got some news for you today. There absolutely is. We're at AZ Pain Centers, and joining me now is Dr. Tricia Croake-Uleman. Hi, doctor. Talking about migraines, as we were chatting, you told me you actually have suffered from them before. They're really horrible.
They are. They're debilitating. I suffered with them since I was 12 years old, and so for 27 years I've been getting them. And about a year and a half, I decided I was going to do the injection, and I did an injection, and then I did a second injection, and I haven't had one for about a year and a half at this point.
You know what? I want to talk about injections, but in just a second, because a lot of people who suffer from migraines, they happen frequently, maybe a couple times a month even, and they really can put you out. People crawl into bed. What typically do doctors do right now to treat migraines?
Typically, they'll get a medication for it. They can either use an abortive medication, which is like a narcotic, like Vicodin, Percocet, something like that, which has the addictive properties, and you like to stay away from that.
And not only that, it puts you out for the day.
It does, and you can also get rebound headaches. You start to take these medications, even the simple ones like ibuprofen and things like that, and you start to get rebound headaches from that. There's also, you can use the Imitrexes, the triptans, and those are medications that you take at the onset of the headache, and it helps to prevent them too, but those also have side effects, and a lot of times people don't function well on those. Can make you very tired or just kind of out of it, where you're just not as sharp.
Sure. And with most drugs, there is a side effect.
Yeah, absolutely. And then of course there's also preventive medications you can do, like the Topamax or the beta blockers, some of the SSRIs and those medications, and again, there's side effects with those too. A lot of people, again, the mental clarity with the Topamax really goes down. Fatigue with the beta blocker, so there's a lot of side effects.
So here you are, a doctor, suffering from migraines, and finally you said, what, I'm going to try something else, and what did you do?
Well, I actually, I've been doing the injections, and I finally was like, I ought to try this. So I had one of the docs here inject me, and sure enough, I've had relief. It's amazing. To have them for 27 years and then all of a sudden not have migraine headaches anymore, it's pretty unbelievable.
When you say injections, what do you mean?
Injections, what we do, first of all, I kind of like to preface that because we do use something that numbs the skin so that you don't feel the needle go in, because a lot of people hear injections and they get very concerned about that. We call it our comfort technology, and so that's when we go in with the needle, you don't feel it go in, then we inject the solution into the areas.
Where do you get the shot?
The shot will be along the cervical spine, and then at the base of the skull. Is where we do the injections.
Okay, so there's a numbing cream or a topical solution, so it's not going to hurt.
It's kind of like a topical solution, but yeah, and it feels like a pinch when we do that, so you do feel a little bit on that, but then you're not feeling the poke of the needle as it goes through the skin.
So let's talk about price. People need to know how much it costs. Is this something that's covered by insurance?
It is covered by insurance, and most insurances, I should say. And what we can do is you can call our office. We have insurance specialists on the spot who can call your insurance agency, and find out exactly, what's covered and whatnot. So that's easily done.
And that's good to know. And plus, I imagine people would pay anything to get rid of migraines, but it's nice to know that it's covered. And of course, everyone wants more information. We talk to you folks at AZ Pain Centers quite a lot. I want to tell you about their website that you can go to get more information. It is azpaincenters.com. The number is 480-821-PAIN, which is 7246. Again, azpaincenters.com. Or you can go to our special health website at AZ Health Spot. We're talking about migraines today, a very big deal for a lot of people. It's nice to know that there is a solution that maybe they've never even heard of. Thank you, doctor, very much. Appreciate it. And Better Arizona will be right back.